Okay, well, welcome again, everybody, officially. We will go ahead and go on record. Today is November 7th, 2023. It is 2:02 p.m., so we're starting on time. Yay, thank you for joining. It is the Nevada Children's Behavioral Health Consortium. And Carrie, if you can please do roll call.
I'll do roll call.
Sorry, get that.
That's okay.
I will learn.
No, that's okay. Thank you. All right. Alexa Rodriguez.
Good afternoon, present.
Good afternoon. Amanda Habash Dayol.
Delay. Hi, this is me. I'm here.
Braden Schreg. Jessica Giacotea. Sorry, I never can say your name correctly. I apologize.
Okachia.
Jessica, are you on? Nope. Okay. Charlene Frost.
Present, thank you.
Marla McDade Williams.
Good afternoon. I'm here. Thank you.
Good afternoon. Dina Schmidt.
I'm here. Thank you.
Thank you. Ellen Richardson Adams.
Here.
Thank you. Jennifer Bavwakwa. Karen Tacher.
I'm here.
Thank you, Karen. No, I saw you. Catherine Loudon. Did I see Catherine? No. Okay. Miambi Newburn Johnson. Melissa Washaba.
Here.
Thank you. Michelle Sandoval.
Here.
Sandy Arguello.
Here.
Hi, Sandy. And Sarah Dearborn.
Good afternoon, I'm here.
Good afternoon.
And I think Miambi just joined too.
Miambi
Yes.
Newburn Johnson.
Yes. Miambi Newburn Johnson. I am present. Thank you.
Perfect. Thank you. Madam Chair, we have quorum.
Wonderful. And for our guests, if you can please sign in through the chat for attendance, that would be wonderful. Would appreciate that. Next, we will go ahead and open for public comment. If you have something that is in relation to the agenda, we welcome your public comment at this time.
Hi, good afternoon. My name's Britt Young, and I'm the Family Peer Support Facilitator at Nevada PEP. And just wanted to share information about our program at Nevada PEP that's called Safe Allies, since we are getting a lot of calls about bullying. Just wanted to share that with everyone, and I will put that in the chat.
Wonderful. Thank you. Appreciate that share. Other public comment? Okay, not seeing any. We will go ahead and close public comment. There will be an opportunity again at the end of the meeting. Item number 3 is for possible action. It's the approval of the June 1st, 2023 meeting minutes. Those were sent out prior. If not, please take a look at them now, and I will open it for a motion. That's the word, motion. Thanks.
This is Sarah Dearborn. I motion to approve the minutes from the June meeting.
Thank you, Sarah. Do we have a second?
This is Amanda. I'll second.
Thank you. Any comments or edits? Okay, seeing none, all in favor, aye.
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 Any opposed? And any abstentions? Okay, thank you. Item number 4 is for information. It's the updated changes to Nevada's open meeting law from the 2023 Nevada legislative session. And Jennifer Spencer, who is a senior deputy attorney from the AG's office on behalf of DHHS, will be providing us with information. So thank you, Jennifer. Welcome.
Good afternoon. Thanks for having me today. I really appreciate it. I wanted to come on today to provide some quick updates on some new open meeting laws that came into effect this July that I believe apply to this public group. I believe a lot of these laws that came to an effect, basically the parties or the public groups have already been complying with. They've now been codified so that it's more clear when you look up the statutes regarding those. So I'm just going to go ahead and read through some of those most important ones. And I also wanted to remind everybody that the DAGs are always available to help with any open meeting law questions. Feel free to reach out anytime. AB 52 in this last legislative session cleans up the language and the definition of a meeting to clarify that a meeting must include a gathering of a quorum of members of the body together with deliberation and action on a subject addressed by the public body during the course of business. The only exception to this provided by the open meeting law is for attorney-client conferences. And again, for the most part, folks already comply with this. It's just been codified, so it's much more clear in statute. For example, a social gathering of members that would make up a quorum is not an open meeting law violation as long as they don't talk about matters that are normally addressed by the public body during the course of business. AB 52 further specifies that unless otherwise provided in law, non-voting members are not counted for purposes of determining quorum of that public body. Also, unless otherwise provided by specific statute, or unless all members of the public body are elected officials, if a vacancy occurs in the voting membership of a public body, the necessary quorum and number of votes necessary to take action on a matter is reduced as though the voting membership does not include that vacancy. So in summary, for bodies not comprised entirely of elected officials, AB 52 changes the general definition of a quorum to exclude vacancies. So for example, if a 9-member body has 2 vacancies, it's treated as a 7-member body for the quorum calculation, and a meeting can be held with only 4 members present. The quorum definition was further changed to specify that only voting members of a public body count when making a quorum calculation, unless statutes pertaining to that specific public body specify otherwise. Next, there's updates regarding remote technology system usage. The open meeting law authorizes a public body to conduct a meeting by means of remote technology system. This was passed in the prior legislative session. What's new in 2023 is that AB 52 made changes to include remote technology systems as one of the means by which public bodies conduct meetings. If the public body is not comprised of elected officials, the public body can opt for virtual meetings by means of a remote technology system. So that includes virtual only meetings, and it includes in-person meetings and also a hybrid. So that's what the intent of that statutory changes. Public bodies can also choose to have an in-person location for meetings and also allow for persons to attend via remote technology. So that would be the hybrid. They can appear through a remote technology system or by telephone. The agendas must specifically include instructions on how persons can join the meetings and where the physical location is, if the public body chooses to have a physical location. AB 219 in our last legislative session added a requirement for entirely virtual meetings that clear and complete instructions for how to call in to provide public comment must be included on the agenda. In addition, if a meeting is conducted this way, there must be clear and complete instructions for a member of the public to call in to make public comment. And it also must be read verbally prior to the first public comment period of the meeting. So the new statute requires that that be read out before the first public comment section. Of course, you can do it for 2 of the public comment sections, depending on how you have your meeting. Some folks have public comment after every action item or during every action item. So the requirement is that it's mandatory that it be done prior to the first public comment period, but it's up to the public body as to whether they want to include it on the second public comment period as well. Another change for those of you who participate in the Nevada administrative rulemaking procedure, AB 219 provides that a public body may not hold certain meetings relating to administrative rulemaking by means of a remote technology system without a physical location designated for the meeting. So in other words, for rulemaking, where you have workshops and hearings to adopt new rules for Nevada Administrative Code, you still have to have an in-person location. You can't just have those remotely. Next, there is an update regarding the public comment sections of the agendas and meetings. The open meeting law requires a public body to have periods devoted to comments by the general public and discussion of those comments at the meeting. So under open meeting law, historically, there's been 2 options for public comment. You can either have them one at the beginning of the meeting and one at the very end of the meeting, or you can have public comment, as I mentioned before, after each action item. And so a lot of groups that have non-voting members like to include this option because it allows not only the voting members to deliberate, but it allows the non-voting members and members of the public to also have their say during that specific action item that they're discussing. Or you can also have a hybrid. You can have a public comment at the beginning, at the end, and during the action item. So it just depends on what the public body would want. And what's new in 2023 is that AB 219 adds a requirement that if a public body has a meeting agendized to continue to 1 or more calendar days and utilizes the public comment option of having one at the beginning and one at the end, then you have to have at least 2 public comment periods on each day of the meeting. So you would have to have it on the first day, the first public comment period, and at the end of that day, and then the second day of your meeting, you would have that public comment at the beginning of the meeting again and at the end. And so there's also some updates on posting the agendas. The open meeting law provides that minimum public notice of a meeting of a public body includes posting a copy of the notice at the principal office of the public body. So what's new in 2023 is that AB 219 provides an update that a copy of the notice must be posted at the principal office of the public body, or if the meeting has a physical location, at that building in which the meeting is to be held. So basically, these are the most substantive changes to open meeting law this last legislative session that I wanted to bring up today. And I also wanted to open it up for anybody if you had any questions about open meeting law in general or the changes that were made this session. Thank you.
Thanks, Jennifer. So I just learned something. I should have read the public comment piece that was on there, so my apologies, and I will be sure to read it when we have our second public comment part. So thank you. Are there other questions or clarifications from the team?
I just wanted to formally say thank you very much to Ms. Spencer. She has presented at all of our consortia and our commission meetings these new updates, and it has just been wonderful to hear all the new changes, and I know everyone appreciates you taking out this time to do that, and I think this is your last one, so I wanted to publicly thank you for that. Thank you.
You're very welcome. And I wanted to remind everybody that the DAGs are always available. You can email me if you have any open meeting law questions on content or agendas or anything like that. I'm always here to help out. So
Thank you. And you're a good teacher, so you taught me immediately. So
thank you guys.
again. Thanks. Item number 4 is information only. Oh, we just did item number 4. Sorry, I didn't check it. Item number 5, announcements from all members.
Madam Chair, may I please interrupt you and ask for another count on quorum?
Absolutely.
We're going to be watching this very closely today as we have a few people that need to leave early. And I know we have at least one person as a voting member that has joined us. So I believe Jennifer Bavacqua has now joined us. So for the record, is Jennifer Bavacqua on the phone or here at the meeting?
I'm here. I'm actually in
Wonderful.
both places. So I missed my call, my name being called. So yeah.
Perfect.
Thank
Okay.
you.
Thank you very much. Sorry to interrupt. Thank you.
No problem. Announcements.
Madam Chair, I have an announcement from the Rural Committee.
Yes.
We just wanted to bring up that we are planning a rural consortium, what are they calling it? Activity day, an in-person activity day retreat. That was the word.
Oh, nice.
And we're looking at a couple of dates towards the middle or end of March. They're not nailed down yet, but it will be in Fallon. So just wanted to let everyone know if you were interested in that, to kind of keep in your mind a couple of Thursdays or Fridays in March. We'll send out an announcement once it's all set.
Wonderful.
Thank you, Melissa, for stating that for everyone. And we will be sending out an invitation if you'd like to present during that time also. We would welcome you to please send myself or Carrie or Melissa a email and request that you come on the agenda. We've been having subcommittee meetings, so we're organizing that now. So we're welcoming everyone to please submit if they'd like to speak at that event. Thank you.
Additional announcements? Erin, anything? Usually you have a pretty awesome announcement. Not to call you out, but don't want to miss it.
You know what? I don't have any announcements. We've just been so busy and we're looking forward to slowing down a little with the holidays.
Hey, fair enough. Busy's good. That means lots of family activities and community outreach.
Right. A lot of families need help right now. So.
Yes, we're second quarter into the school year, so it's a timely time, right? Michelle Sandoval, anything you'd like to share? Wink, wink.
I can't think of anything. Am I missing something, Ellen? I think kind of like, what Karen said with PEP, we have been really busy as far as crisis services in our rural areas for youth and families. I think we had a record month in October of calls that have come in from Mobile Crisis. So I agree. There's a lot of families and youth out there in need right now. And thank goodness we do have some services to help them.
And there's been an uptick in face-to-face out of Elko too, correct?
Yes. Our pilot face-to-face program out here in Elko there's a big uptick, and I credit that to just a lot of outreach. So that is working. And on the other side of that, we have had numerous youth who have completed suicides in our rural areas in the last few weeks as well. So there's still a lot of help that we are offering our rural communities, and just huge shout out to all of our community partners who have pulled together and helped the schools and families and communities.
Thanks. That wasn't part of the wink, but that is very true. And you did get the other part of the wink, so thank you.
So, Michelle, you said, what, did you give us a number? I don't want to say, I thought I heard you say numerous.
Of completed suicides or
Yes.
mobile crisis calls. I think 2, 3, 4, 5, 6 deaths that I know of since the start of the school year.
Oh my God.
Been a rough one.
It's been a rough one.
Thank you for sharing. And that's all in rural communities?
Yes. Yeah.
So changing it to a positive. Any other announcements? Sherilyn.
Thank you, Chair and Board. Sherilyn Marwood, for the record, Regional Behavioral Health Coordinator for Carson City, Churchill, Douglas, Lyon, and Story counties. And we just recently, I just recently released the 2023-24 Behavioral Health Resource Guide. And I'm going to put the link in the chat. Hopefully that'll open. It's really geared towards those 5 counties. But, you know, nowadays people are moving around and utilizing services outside their counties anyway. So it could be beneficial. I'll put the link, like I said, in the chat. And if you can't open that, you can also retrieve it from the coordinator's website, which is nbbh.org. And I'll put that in the chat as well.
Wonderful, thank you. I've been passing those out also, even to some of our staff here in Las Vegas, because as you said, people are linking all across the state. So it's a very comprehensive resource.
Thank you, Ellen.
Any other announcements? Okay, not seeing any hands, not seeing any names come off mute. Go ahead and transition to item number 6, which is for possible action. On this particular agenda item, on the original, we had the dates that were going to be for the next coming year is January 11th, April 11th, June 13th, September 12th, November 14th. There has been a correction that was sent as one of the attachments with the corrected dates and times. You look for that schedule. The dates that are proposed are February 1st, 2 o'clock to 4 o'clock, April 4th, 2 o'clock to 4 o'clock, June 6th, 2 o'clock to 4 o'clock, August 1st, 2 o'clock to 4 o'clock, and October 3rd, 2 o'clock to 4 o'clock. Those will end December 5th, 2 o'clock to 4 o'clock. These 6 dates will remain on Thursdays and at our 2 o'clock time frame. Are there any questions or comments or concerns? Excuse me. If not, is anybody comfortable making a motion to adopt those dates that were just read out, dates and times that were read out loud?
Ellen,
This is Shar. I'll make a motion to accept those dates.
This is Amanda. I'll second.
And a second. Sorry, Dina. Any comments or revisions? Okay, hearing none. All in favor? Aye.
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 Any opposed? And any abstentions? Wonderful, thank you. And sorry for that that misprint, but we got it corrected. So we will make sure the calendars are marked for our 2024 year. It's hard to believe it's going to be 2024 so quickly. I feel like we were just starting with 2023. So item number 7 is for information only. We have a new administrator for DCFS, so would like to welcome Marla McDade-Williams. Ms. McDade-Williams has been with DHHS for, gosh, Marla, like 20 years, I think. I've been with the department for 20, so you might even have more than that in, but we welcome you. Very excited for your new role and partnership. So welcome. And any updates you'd like to provide?
Thank you, Ellen. So actually, I think I started with the Division of Public and Behavioral Health in 2005, and then I left in 2014, and then I just came back to DHHS last January. So so I've been back a little over, I don't know, whatever 12 plus 10 is, 22 months, almost 2 years. But I am serving now as the administrator of the Division of Child and Family Services. I think, I don't know, 6 or 7 weeks now in the position. We just, some highlights. We are currently working through the regulations development and adoption process for qualified residential treatment programs. Would include licensure of QRTPs as well as certification and oversight of services. We also will be moving forward to regulatory changes that would allow us to submit our state plan to implement extended foster care, which would allow us to provide services for children older than 18 years of age once they age out of the system. We do have the over child welfare. Tanya Hernandez has been hired, and so, she's maybe got a few more weeks in than I do. She has been meeting people, learning the systems, kind of learning some of the challenges, and we are continuing to work through and try to see what we can do to make things better in terms of getting homes licensed so that we don't have problems with placements. Dr. Cindy Pitlock has left the agency as of November 2nd, so I'll be doing a recruitment to fill her position. I think that's it, very high level, and I'm happy to answer any questions.
Questions?
I don't have any questions, but I did want to welcome Marla and let her know that this is her cheerleading team here, and all of these committee members want to partner with DCFS.
I can certainly use a lot of cheerleading. There are significant challenges that we're facing, and trying to learn what they are and understand what past efforts have been, to try to fix some of the things. I've been around more than 30 years in the state. I started with the Legislative Council Bureau, and I know that DCFS has always been one of the agencies that's faced the most challenges. And so, honestly, I'm looking forward to seeing, how we can all work together and figure things out. And I'm really just ready to do the work.
I agree. Been on this body for a long time in different roles and capacity, and this is one very committed group to children, to policy, to support. And so if there is anything on behalf of this group that can support DCFS and the behavioral health side for DPBH for children, we're definitely there. So, and ADSD also, Dina, sorry. Any other questions, comments, feedback? Okay, thank you. We definitely welcome you, and yeah, will be a good one. Will be a good run. Item number 8 is for the care management entity presentation. We received word from them Late last week, they asked if they could be put to the December agenda. So we are going to table this one for today and have them present for December 7th meeting. So please, if you're able to attend, this will be very informative, and I think will bring a lot of good information to the table for us. So I encourage you to attend and understand that they weren't able to be here today. So table number 8, item number 9 is for possible action. Jacqueline, is their last name wrong? Help me, Kristen. Oh, sorry.
Oh, I was on mute. Sorry. I have a hard time saying her last name too.
Go ahead,
Klein-
Shar. help us.
Goycochea.
No,
No,
Klein. Klein.
Kinder.
I'm sorry.
It's okay.
Jacqueline, she's from the Reno. Cannot say her last name. I'm embarrassed. Jacqueline K.
Klein Edler.
Thank you.
Klein Edler. Yes.
Yeah.
Sometimes it takes
chair
all of
the
us.
Washoe County Children's Mental Health Consortium.
Yes.
And she has resigned.
She has. And so for that, she resigned as vice chair for this body. So we are in need of someone to step in and help support as the vice chair position. I promise I will learn and say your name properly, as I just failed for Jacqueline, but appreciate her time and service. I mean, she really was dedicated and very helpful for so many years. So we can do this 2 ways. We can have somebody that would first step up and be very interested and want to share their time and dedication, or we will be open to gracious team member votes or volunteers, right? Nominations, I guess is the right word for that. So open to either one. If somebody's very, very interested, or if you feel very strongly that someone would support that position in a wonderful way, we will take that nomination as well. And then from there, we can go by vote. Shar just covered up her camera. Was that a volunteer? Was that like a hand?
No, I was rubbing something off my screen.
Oh, I thought that was a pick me. I was like, okay. Shar, it's never fun if I can't pick on you.
You're always welcome to pick on me. I take nothing personally.
Wonderful.
Is Shar interested?
I am happy to serve in whatever capacity you would like. So.
Sorry.
Every
Go ahead,
I
Karen.
don't. I guess I would like to nominate Shar as the vice chair, since I don't hear any other people putting their hands up or cleaning off their cameras. So,
And my name is easy to pronounce.
yeah,
That is true.
All right, so I nominate Shar for vice chair.
Okay, we have one nomination for Shar Frost as vice chair. Any other nominations?
Ellen?
Yes.
I know somebody that I've seen a lot really rise up during these meetings, Jessica Goycochea. I don't know if she'd be interested, but I would like to nominate her if that's possible.
Okay. So we have one nomination for Shar and a nomination for Jessica. Both who I can say names, so that's good.
And I can say the Goycochea name because I'm from Elko County and the Goycocheas are from here. That was an easy one.
How embarrassing. I'm so embarrassed.
Michelle, this is Marla. I can say Goycochea too. I'm also from Elko.
Oh, fun.
Nice.
I didn't know that, Marla.
And I'm Basque,
I
so
can say it because of Senator Goycochea. So
You guys are so funny.
I'm Basque and I used to live in Elko, but I'm not from Elko.
Yeah, that's so cool.
That's cool. Any other nominations? Okay, so we will need to do a hand count. So for voting members, please use the little hand count thing and then we will verify by verbal count. All in favor of Shar Frost as vice chair, please raise your hand. We'll do, and I'm going to abstain just as an FYI, since I'm doing the commission piece. And then Kristen, can you do a hand count?
Yes, Madam Chair, there's 9 for
Okay.
Shar.
And next we will do a vote for Jessica Gokachia. So if you could put down your hands. And then raise hands for Jessica Gokachia, please. And then Kristen, you could do the count.
Yes, Madam Chair, for the record, we have 3.
You. So looks like based on vote, we have a nomination for Shar Frost as vice chair. If I will open for a motion for Charlene Frost to be, it's Charlene, right? Technically.
Only my mother calls me that.
Okay. We have a nomination for Charlene. I'm going to tease her. Charlene Frost for nomination for vice chair. I'll open for nomination. Or yeah, for the motion, sorry.
Ellen, I don't understand.
So I just want to verify the vote. So we'll do a first and second motion and then go to just solidifying the vote that way since it's for possible action.
Okay.
So like we're doing a 2-step.
Got it. All right.
I'm erring on the side of caution, Karen.
So you need a motion
So
to
you need
approve
a
Shar as, okay, so I'll make a motion to approve Shar as the vice chair.
Thank you. Dina has a first. Sorry, those were poor instructions. I'll own that. Is there a second?
I'll second that.
Karen. And then all in favor? Aye.
Aye.
Hi.
Aye.
Aye.
Any opposed? And any abstentions? All right, we'll welcome Shar as vice chair. And thank you. And thank you, Ms. Gokachia as well for, not sure if you're on, but for allowing us to nominate you in consideration. There will be other positions coming up, so definitely opportunity on the horizon. Item number 10 is also for possible action, and the request last time was to dissolve the legislative work group until needed again for next legislative session. And so wanted to put this up formally to see if there was an interest to continue this group or to dissolve this group until needed potentially next year at this time.
Ellen,
Go ahead.
thank you. I'll make a motion to dissolve until our next legislative session.
Thank you. Is there a second?
Jennifer,
This is Michelle. I second it.
Okay, Michelle is a second. Sorry, I didn't catch the other person. All in favor?
Aye.
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 Any opposed? And any abstentions? Okay, thank you. So we will go ahead and formally dissolve the legislative work group and probably will look to put this back on the agenda this time next year. Item number 11 is informational only. So Medicaid updates and changes by Sarah Dearborn. Thank you, Sarah.
I see that Sarah's still on.
Ellen, you're on mute.
I was saying it looks like Sarah's having technical difficulties, so we'll give her a minute, but I know my laptop, the mute and unmute doesn't cooperate, so. And then you said, Ellen, you're on mute, so that was kind of funny. Evidently my computer on my desk doesn't either.
Sarah just did say that she's having technical difficulties and that she's going to log back on. May I suggest we move on to agenda item number 12, come back to 11?
Agreed. No worries. That sounds like a good plan. So item number 12, informational only, is the update on system of care grant. Bill, would you like to provide us those updates?
Absolutely. Good afternoon, Madam Chair. Bill Weitz with DCF Best System of Care, along with our staff here. And I apologize for those who have heard this spiel before, as I'm on the consortium and on the commission as well. For this group, we received our System of Care extension for year 5 from SAMHSA. This gives us an additional year to work with our grantees as we plan to work more closely with our grantees regarding what they plan to accomplish in year 5, sustain the ability to connect their work. So I think we're good with year 5, and we're very grateful to get that funding. Because this grant ends in September of 24, we're looking at submitting a new System of Care grant March of 2024. They've actually put out the next 3 years when this grant's available, which is very odd, but it gives people an opportunity to plan. So a significant phase of this work is gathering community input of ideas to improve Nevada's children's behavioral system of care. So we plan to have open discussion of ideas in various consortiums and commissions over the next several months. DCF's leadership will make the final decision, but again, community input is a key component for applying this grant that SAMHSA highly wants folks to do. And again, these are highly competitive grants. So I've always saying, if you're not going to do 110%, just don't do this, because they're very highly competitive, and but they're very rewarding. 4 years of $12 million. Also, SAMHSA has advertised the System of Care grant for March of 2024. They still will issue a notice of funding opportunity sometime, I think, December to February, maybe, which provides more specific details on what they expect in the grant. So just some ideas that staff came up with here as a school-based mental health state approach. And that could include social emotional learning curriculum, of course, involving youth, identifying needs as a huge part of this, out of school time enrichment, resiliency programs, youth suicide resources, after school programs, traditional living, possibly building additional workforce service providers, build a transportation network and resources. So really, Ellen, how best can we get input? Because I know you folks are on a quarterly meeting, and Karen Teacher has a great idea. Has asked me to put together a one-pager that gives the key information about the components of the grant. So I'm not sure, because I think your next meeting is not February. That'll probably be too late, maybe. But is there a way, Ellen, that we could get feedback from the group? Again, we want to have the funnel be very large at first to get ideas. And then as we bring it to our leadership, I see Marla's on today, to really have that discussion with leadership about what they think is a good approach to go. But again, the strength of these grants is the community input to find out what folks are really seeing out there that can help move the state in a positive direction. So I'm not sure what the best way to do this. Like I said, I'm going to put together this one pager that lists all the elements that are required in the grant. But again, however you think it's best to go forward, I will refer to you.
Partly good news, and Marla, I see your hand also, so feel free to chime in. Our next meeting, we postponed the October meeting to today. So our next meeting that's normally scheduled is going to be December 7th. So if that's workable feedback time, we can add that as an agenda item. If not, we can look at another option. Marla, did you have something to add as well?
Just wanted to, say that I think it's important to really see the list of acceptable types of activities for funding.
Right.
I'm leaning towards direct services. I feel like we have such deficiency in our state for direct
Yes.
services that if we aren't actually applying for funding to provide direct services, that we aren't, we're never going to make a dent in what's going on. So, I mean, that's kind of my preference. But yeah, this one pager will be key to ensuring that we get people focused in the right direction.
Right. Yeah. Thank you, Marla. I totally agree that, building the community infrastructure out for services, as Marla said, is a key thing to do in Nevada. So getting ideas, but I think that approach could be very helpful in moving the needle forward. So thank you, Marla. And so I'll put that together because these grants have very specific components in it, and they have things you can't do and things you can do. They have things you need to include in there. So I will put that together so folks have that. And then maybe December 7th is when we could have on the agenda, Ellen, to have that conversation, and here's people's ideas. But I think Marla's right on. Is there, what are the direct services we need, and really focus in on maybe that and how it might work. So I appreciate that. Any questions or thoughts?
Bill, do you have plans to meet with any families or youth about the new system of care grant?
Well, that's something we should do, Karen, and somehow maybe you can help facilitate that, or other agencies can help facilitate that. Because you're right. And this is about families and children and youth, not about me or anyone else. So whatever we can get input from those folks, it makes it stronger. And that's the other thing about this, which I like this time frame, is a lot of times these grants come out and people scramble, throw it together. This gives us an opportunity to really get some rich feedback from folks about what looks good for the community, and certainly from families and youth. So Karen, let's talk about, because I know you and I are meeting this week, let's talk about how we could coordinate that.
Okay, thank you.
Absolutely. Any other questions? Melissa, go ahead.
Is one of the allowances, would any sort of like travel funds for services be able to be included for families?
Tell me more.
So here's my idea where it came from. My facility is working on a new program to be able to do the ADOS testing for autism diagnosis for children, which is a service that's really difficult to find in our northern region. But I'm in Lovelock, and my rural counties can be very far apart trying to get this service. Right now, they have to travel to Reno, and hopefully will be another resource, but I know that it's very difficult on families trying to get testing done or appointments.
Well, I tell you what, Melissa, when they put out the new NOFA that will give more specific detail about what this grant should have, I'll look at that component as well.
Thank you.
Of course, of course. Any other questions? All right, Alan, thank you. I appreciate your time today. We'll look forward to a conversation on the 7th. And I think what Marla says, let's look at services in the community, whatever that might be. That's a good discussion to have.
Great. And Sarah, we'll go back to number 11 for updates on Medicaid. Thank you. Sorry about that.
No, I had a feeling because I didn't see anyone talking. I'm like, oh my gosh, I don't hear anyone speaking. So it worked, but let me know if you lose audio connection. I'm happy to log out and log back in. But that worked. And I'm going to steal Bill's line. I apologize to those of you that have heard this presentation. Many of these topics you feel probably are like a broken record. But I'm going to quickly review some of the topics that I know I've talked a lot about on the consortium, where I don't have as many updates, but still just want to give folks a chance to visually see them as well. So I do have a presentation. Visuals are always helpful. Okay. All right, this is a very robust presentation, so I'll do the best to summarize it. So here is the agenda. I've added a lot, but there's just so many exciting things happening, so I don't want to forget anything. So first, just want to mention for everyone, I know this consortium as well as other consortiums continue to have questions around the COVID unwinding. I am certainly not an expert in that area, but want to provide the website for further research. If there is more questions around this, I can connect individuals with our project manager that's overseeing that as well. But just want to highlight this, the website to go take a look at. Also, wanted to provide just contact information for any providers that are having issues with billing or enrollment purposes. Your first resource is really our fiscal agent, Gainwell Technologies. So there we have provider field representatives that can support with more of those specific details. And then just wanted to take the opportunity to let everyone know Medicaid has established a new unit. We have a federal waiver and community engagement unit that we're excited about. We just completed the hiring process for the new chief that's over that unit, Michael Gordon. Many of you may know who he is. He was leading our Northern District offices, so now he will be leading our federal waivers unit. As you'll hear, and even from legislation, there was quite a bit of waivers that were required Medicaid to apply for, so we definitely need that expertise in waiver development. And then we have a community engagement unit that we're excited about to help direct providers to kind of as a one-stop shop, and then resources can be deployed after that. So please utilize this email address if you have further questions. This is a place to start. And then many of you may have participated or heard Medicaid did put on a legislative stakeholder implementation meeting back in September. That recording is now available on our YouTube channel. So once I send all of these items to Kristen and Carrie, the links will be available in the presentation as well. And I encourage everybody to review that recording. Lots of great stuff that Medicaid is working on. The two state plan amendments that we have currently under review, no new changes here. So the first one is related to crisis services, which this state plan amendment includes intensive crisis stabilization services, as well as mobile crisis response that's delivered by a designated mobile crisis team that complies with Section 1947 requirements. I'll provide a bit more detail on the state plan and some more visuals to help you all kind of understand and picture what is in process with CMS with our crisis services. The next state plan amendment that we have, so this is also on RAI or pause with CMS as we work informally, so off the 90-day clock. This is in regard to our certified community behavioral health centers, and a lot of this doesn't incorporate new services. This is really more about details related to their quality incentive payments and requirements around cost reporting for them. So again, no new services, but hopefully we can get some movement on these state plan amendments soon with CMS. Did want to mention these kind of upcoming Medicaid service manual updates. A lot of these are not our typical Medicaid service manual updates, especially with Chapter 400. So these are some different chapters that I wanted to call attention to. We are hosting a public workshop on this Thursday, November 9th, from beginning at 10 a.m. And this is in regard to proposed updates to our Medicaid Service Manual, Chapter 2900, which is very specific to our federally qualified health centers. The proposed updates are specific to how behavioral health services are delivered. in an FQHC. No new services. It's really more just about clarifying language, who can provide behavioral services at an FQHC, for example. So that is a public workshop. Public workshops are where we really would like provider engagement, feedback, public engagement on our proposed edits. So these are all posted on our public notice website. The next two MSM updates I want to mention, these are moving forward to our November 28th public hearing. And they're moving directly to public hearing because they're a requirement through legislation. So the first is Medicaid Service Manual Chapter 3400, which is specific to telehealth service delivery. As a result of Senate Bill 119, Medicaid is required to ensure that audio-only services are able to be delivered, which includes audio-only behavioral health services as well. We are adding language into this chapter that really emphasizes the need for telehealth delivery, whether that be audio only or audio-visual service delivery, to be medically necessary and clinically appropriate for the individual receiving that service. The next area that we're making changes to our Medicaid Service Manual Chapter 3800, which is our medication-assisted treatment chapter, as well as MSM 600, which is specific to physician services. And these changes are required as a result of Assembly Bill 156. And these changes are specific to allowing a pharmacist to be able to be an allowable provider of medication-assisted treatment for opioid use disorder. So this will include updates to these two MSM chapters, and then we'll be also moving forward a state plan amendment change within this update. So a busy November. I do have some more announcements for November, Thursday, specifically November 2, later on in the presentation. I like to mention just to everybody, keep everybody abreast of what's going on in our Support Act post-planning demonstration. Not a lot of new activity, just a lot of focus still on the development of a new provider type for substance use treatment services that will allow for individuals to enroll. So all of our substance use treatment professionals will be able to enroll as an individual. We're creating some new groups under this specialty as well to align with our most recent 1115 waiver approval, so that we can really collect data on who is actually performing the services. Also specific to institutions for mental disease that are now able to perform substance use treatment services. We're establishing a new group enrollment for them as well. So that is coming. Our expected implementation of this new provider type isn't till about March of next year. Just want to keep everybody engaged on this change. There will be a lot of provider education and support provided so that our 17215s will feel supported when rolling over to this new provider type. The next big piece that Nevada's working on is in regard to our 1115 waivers. I think during this last legislative session, there was a lot of interest in having Medicaid pursue waiver authorities to integrate new services, be creative with how to deliver services. 1115 waivers are a large commitment for states. So this is just our kind of initial step into the waiver party. I'm going to be as positive as I can with waivers because they're really hard. But yes, this 1115 demonstration. So this 1115 allows for substance use treatment within what's known as an institution for mental disease. We are working vigorously on the several deliverables that come along with 1115s. We received our implementation plan approval, which was great. That's really the meat and potatoes of what Nevada will be doing over the next 5 years. to ensure that this waiver is a successful demonstration. We recently received approval of our monitoring protocol, which this is a lot of data. So if you're interested in data, this would be a great document to view. We will be most likely referencing this document from the CMS website because it is a very large document that has lots of data metrics, but essentially requires states to collect an immense amount of data related to substance use treatment. Next, our evaluation design. We were able to submit that to CMS in October, and this allows for an independent assessor to evaluate how Nevada is doing. So Nevada Medicaid is not able to evaluate it. States hire vendors to be able to do that. So that's part of the evaluation design. We submitted that to CMS. So hopefully we'll hear back and they like our evaluation design and our goals associated with that. The next piece I wanted to mention is our post-award forum with some recent communication from CMS. All these awesome presentations that you all allow me to do on these public meetings. It sounds like I may have met requirements already for a post-award forum, but really I want to be able to also communicate what's happening around our state plan amendment to incorporate a bundled daily rate of service. So I am, even though I've met this requirement, we do want to put out kind of another post-award forum public workshop to go into specifics around updates we're going to make to our state plan as it relates to that kind of bundled residential service and then the rates associated as well. This slide really just kind of talks about the next steps with the waiver. There is a lot of work that will be done, again, with that state plan amendment moving forward. We're hoping for to move a public workshop forward in January around that. We're working with our rates unit on establishing kind of a bundled rate for those services. The next piece I want to mention is our Mobile Crisis Planning Grant. This grant did end September 29th. And the major objectives of that grant were Nevada being able to develop and integrate services that are for mobile crisis response delivered by a designated mobile crisis team. We already reimburse for mobile crisis services, so this is kind of that more beefed up model of mobile crisis delivery. And then also integrating new services. So the integration of intensive crisis stabilization services, that's all incorporated in the state plan amendment. The next slide I have kind of illustrates it a little bit better. And then the other piece for the grant that we focused a lot on was development of a new provider type 87 for crisis services, where we can really kind of organize all the those kind of enhanced models of crisis delivery, where that's really the sole focus, all under one provider type. So this slide kind of lays out in general what the state plan amendment that I mentioned before does. So this state plan amendment really is about the rate methodology for intensive crisis stabilization services, as well as the definition of what intensive crisis stabilization services are. So intensive crisis stabilization services, you all have heard of crisis stabilization centers. These services will incorporate both that crisis stabilization center model that is very specific to a hospital, but is also going to allow for perhaps a community facility-based provider to also become a crisis stabilization program, just ensuring access across the state. Both models will receive a daily rate for these services, and will have a dedicated provider type and specialty, just depending on which model you have. And then the last piece of this state plan amendment incorporates our new coverage language for, as CMS notes it, Section 1947 requirements. Nevada calls it designated mobile crisis teams. So those are one and the same if you hear of both. This next slide, and again, you'll get this presentation, but this slide kind of lays out what each of the specialties under this new crisis provider type are, the specific codes that will be utilized, and as well as the rates. Again, most of this is pending CMS approval still, as we work with them through lots of various details. But this kind of gives you an idea of what it may look like, but prior to us being able to publish our billing guides and enrollment checklists. This next slide, wanted to give an overview of what our behavioral health benefits and coverage unit is doing at Nevada Medicaid. So a lot of the focus of these bills, and some of these bills have a quickly approaching effective date, and some are a bit more out into next year. So first, Assembly Bill 137, this required Medicaid to develop services for individuals with fetal alcohol spectrum disorder. This becomes effective January 1st. That does not mean services are going to be reimbursable on January 1st. There is a significant amount of work that needs to be done. What we are working towards is possibly developing a health home model for individuals with fetal alcohol spectrum disorder. We're also thinking about how to incorporate pre and postnatal individuals into this model. Nevada does not have health homes, so this is a brand new model, so quite a bit of research still needs to be done around this, but once it's up and going, I'm happy to update this group as we go with this, but that's an exciting new service that will come on board soon, hopefully. The next bill is Assembly Bill 138. And this requires Medicaid to reimburse for behavioral health integration services, also known as the collaborative care model. This isn't effective until July 1st of next year. So we have some more time to work on this, but our team is researching the details of this currently. The CMS has put out some specific codes that will be utilized to reimburse providers for the service as well. The next two bills I've already talked about, so Assembly Bill 156 and Senate Bill 119, those are what is being heard on our November 28th public hearing agenda related to pharmacists and MAT, and then audio-only telehealth. The next bill our unit is focused on is Senate Bill 191. This bill required Medicaid to expand applied behavior analysis services from the age of 21 to the age of 27. So currently, state plan only allows for up to the age of 21. For discussing this internally and with administration, we are proposing to actually amend our state plan to include applied behavior analysis as a service that would be appropriate for any age that those individuals are medically necessary for, rather than limiting it to the age of 27. Lots of the testimony that was heard during that bill was autism doesn't stop when you turn 21. Essentially, autism doesn't stop when you turn 27 either. So opening it up to all ages is what we're moving towards. So look for public hearings on that in early next year to hopefully get that effective. The next area is related to our Medicaid budget. So two things happened as part of our much more than two things, but two things in our unit happened as because of the Medicaid budget approval. First is we are able to expand the number of certified community behavioral health centers that we have statewide. So this is very exciting, definitely a robust model. We currently have 8 certified community behavioral health centers across the state. So beginning January 1st, we will be able to open up enrollment for that. In order to support providers, we are hosting a public workshop listening session this coming Thursday, November 9th, for prospective providers who are interested in the Certified Community Behavioral Health Center model, and requirements that come along with becoming a certified provider. So please join us. That's also published on our public notice webpage as well. The last piece of our Medicaid budget that I wanted to mention is as part of the approval of our budget, it was a requirement to eliminate biofeedback and neurotherapy services for the treatment of a mental health diagnosis. Neurotherapy has some specific codes that are utilized to perform, so those codes will be eliminated beginning April 1st, 2024. Our regular psychotherapy codes will still be available, but it's just those specialized neurotherapy codes that will be eliminated. This slide just talks a little bit more about our CCBHC and how we're expanding beginning January 1st. We are also moving out of our demonstration and into state plan authority. It doesn't change really the service delivery. It's more about what authority Medicaid was using for certified community behavioral health centers. The next slide, just wanted to mention, everyone is aware of a Department of Justice investigation. I don't have any details to share with you, but hopefully in the coming months, we're able to share more. But currently negotiations are still happening there. And then this last slide is very busy, but trying to make Medicaid exciting and colorful. So if anyone's interested, this is really just an overview of the next couple months of what Medicaid is working on. So quite a bit of work there, but we're excited for so much movement in the world of behavioral health. Stop there and see if there are any questions.
Thank you, Sarah. As always, super informative and like truly informational, like stuff that we all can use. Are there questions or feedback?
Sarah, this is Karen. You talked about the crisis centers. Are these the same that we were talking about several months ago, maybe over a year ago, for youth? Or is this for mental health specifically? Can you say a little more about that?
Sure. This has been, at my time at Medicaid, this has been by far the longest state plan amendment I've ever experienced. So Medicaid submitted a state plan amendment March 30th of 2022. And that was a requirement from Senate Bill 156, which was really specific to crisis stabilization centers, which is that hospital model. Hospitals can receive an endorsement through several discussions with CMS and just internally as throughout the state and public meetings such as this, hearing from providers. Medicaid covers in our state plan. The intent is that Medicaid covers Medicaid eligible or services for Medicaid eligible individuals, not specific to age. Usually if you're going to be specific to an age group, you would need a waiver of some sort. So this service would cover those providers that are interested in performing intensive crisis stabilization services. And back on that slide with all the busy rates and codes, we've really tried to make opportunity for all providers that are interested in performing these services, that perhaps if a facility maybe isn't equipped to handle crisis stabilization for a youth, maybe they don't have a lot of child specific staff, there still is a requirement that if an individual walks into a crisis stabilization program, they need to be assessed and at least referred somewhere. They may not be eligible to receive that whole crisis stabilization daily rate, but they need to be seen. So we recognize that some providers kind of had that focus of, well, we're going to do adult only, or we're going to do child specific. So Medicaid's staying out of that piece essentially and ensuring that we can allow for coverage of all, which is why we've also incorporated that community facility-based model, just so if there's not a lot of hospitals that are able to do this, that maybe we'll have some community facility-based providers that can do it.
Okay, so it is what we've talked about previously.
Yes.
So if I don't have Medicaid and I show up at a crisis center, I still get an assessment and a referral.
So the hospitals are going to function a bit differently, and I'm definitely not an expert over our hospitals, but I'm pretty sure that is how it is with our hospital policy. Kind of similar to how our certified community behavioral health centers function. Like the intent of having kind of that daily bundled rate is to really support programs in if someone does perhaps walk in that is not eligible for Medicaid, that they still can access services somehow. I can't speak to the uninsured population, but perhaps that might be an opportunity for where other divisions may be able to support pieces of that. I know there's a lot of talk right now around with our sister division over at Division of Public and Behavioral Health in supporting interested crisis stabilization providers as well, and just seeing how we all tie together and support the whole program as a whole.
Thank you, Sarah.
Mm-hmm.
Any other questions or feedback? Sarah, I just wanted to add a big thank you. I know I lean on you a lot, and I'm always sending people your way, and really everybody always says you're very helpful. Feedback I've gotten indirectly just on these presentations is it really feels like information they can take away and use. And of all the years I've been on here, this is the most comprehensive set of information every time we come to meet to the table, and feels like Medicaid's truly a partner. And this is what we have going on. This is what we can do. You solicit feedback versus always feeling like it's a big no. So I just wanted to take a moment and say thank you for that, because it really does make a difference. So
thank you so much, Ellen. I appreciate it. I love the cheerleading. So Marla, this is an example. Like, they're great cheerleaders. Thank you.
We will move then to item number 13, update on Pediatric Mental Health Care Access Program Grant Award for DCFS. It looks like there's a few people that are able to provide those updates, so I will turn it over to you. Thanks.
Good afternoon, Nicole Mara for the record, Nevada Pediatric Psychiatry Solutions with DCFS. I'm happy to be here with you today because it means that HRSA, who funds the Pediatric Mental Health Care Access Program, also colloquially known as NVPEDS, was slated to sunset on September 29th, but we were provided and granted our 12-month extension without funds, which will allow us to continue our important workforce development efforts while utilizing the momentum that we gained last federal fiscal year. So if it's all right, I'd like to share my screen, and like others, I apologize if you've already heard my spiel, but there were a few meetings that we weren't able to present our end of year achievements, and I'd like to do that here. So last federal fiscal year, we achieved over 10,000 disseminations of 33 educational and informational publications, and they included issue briefs, telegrams, and infographics that covered topics involving youth mental health. With that, additionally, we were able to sponsor 756 participants through 104 live and self-paced asynchronous training opportunities. And just over 25% of those participants represented rural and frontier communities in the state of Nevada. And that was really exciting because our target audience really focused heavily on the rurals and frontier communities members. Additionally, those trainings resulted in 23 certified CAMS trained mental and behavioral health clinicians, 17 REACH Institute patient-centered mental health and pediatric primary care trained primary care providers. Again, that's a mouthful. 9 certified Circle of Security parenting attachment program facilitators, and 8 certified 0 to 3 DC 0 to 5 trainers, who then in turn provide the 3-day DC 0 to 5 clinical manual training to clinicians across the state that primarily work in early childhood mental health. Additionally, the HRSA-sponsored PMHCA expansion project that we were awarded last fiscal year, which is a hybrid youth peer support specialist and community health worker paid internship program, which is a collaboration between the NAMI Nevada affiliates and High Sierra AHEC, the area health education centers, has been demonstrating success and a lot of value. The young adult interns have completed most of their required trainings, both the set required trainings through NAMI and the CHW trainings and the DCFS trainings, which included the system of care overview and the advancing health equity, and just there's so much work that goes into this training. I could spend just a really long time explaining all the different trainings and all of the different educational experiences that these interns are going through, but it really comes down to the fact that they are currently acquiring their practicum hours in various healthcare settings and youth support settings. Several are preparing to test for their certification through the Nevada Certification Board. And the expansion project team leaders are working to secure additional practicum sites, and while also exploring partnerships with various integrated healthcare settings that may be interested in becoming post-certification employment locations. So if you know anyone who's interested in having one of these highly trained youth peer support specialist CHW hybrid certified young adults with lived experience, I'm sure that we would love to hear if there are any spots out there in the community that would like to have some of those staff in their employ on their healthcare teams. Last month, HRSA also approved the no-cost extension for that expansion project as well, so that the interns will be able to complete all of the planned activities with the additional time allotted. So stay tuned for more educational publications and sponsored professional development opportunities to come. If you're not already on the NVPEDS listserv and would like to be, I will pop our email in the chat and feel free to send me an email and we will get you on our listserv so that you can receive publications and be notified of upcoming trainings, educational opportunities, and sponsored events. So thank you.
Thank you. And you're right. Normally we've lost quorum by the time it's come up for you guys to present. So really glad we got to that point today, and thanks for saving all the information. Sounds like there's a lot of really good things going on. Are there questions or feedback?
This is Dina. I just want to say thank you. I know I forward all the emails that I get to my team, and many of my staff have attended some of your trainings and just even your notifications and the little tips and tricks and tools, and they are very appreciative. So we appreciate the work you guys have been doing.
Thank you. It's my pleasure and a very humbling experience to be able to do so.
I agree with Dina. I just thank you, Nicole, so much. Like the statistics, the data that you just showed us, I don't think it even comes close to the far reaches of, I think, where we've all passed on the information that you provided us. And it's wonderful and really good information for families. And so I appreciate it. I look forward to the newsletters every month. And so thank you.
I'm so happy that they're helpful.
Oh, that's actually a good question. Would that be useful for us to share out through Carrie for everybody on this team? I know I get my information from a different link, but just thought about that. Would everybody be interested in that? Yeah, okay. We'll start doing that. So we'll start spreading the word even wider.
Fantastic to hear. Thank you.
Welcome. Thank you. So item number 14, which we haven't gotten to in the last couple meetings, so very exciting. Possible action and recommendations for agenda items for next meeting. So we already have a few items slotted. One will be the presentation from the care management entity, and then bill for DCFS with the system of care for feedback, etc. Are there other items that the team would want?
Ellen, I wonder if there'll be any news about the DOJ by then. If there is, maybe that can go on the agenda.
Okay. And how about this, Karen, for commitment? If it's not available quite by then, commitment that when it is, we will for sure put it on the agenda. Is that fair?
Mm-hmm.
Hello, Ellen. I would like to recommend that we have an update from the Rural Children's Mental Health Consortium in regards to their retreat summit. By then, we should have the agenda mostly set, so I think that would be beneficial to the team.
Great. You have homework, Melissa.
And we also have our standing agenda items that we will keep on the
Perfect.
On the agenda.
Any other requests?
This is Michelle. I was wondering, maybe sometime in the next couple of meetings, I would love an update from the Office of Suicide Prevention. And they have their youth coordinator. I would love to hear the efforts I think they're doing some amazing stuff. I think it might be good to get an update from them if possible.
Okay.
And again, with the recent completed suicides in our rural areas, any resources that we can use for outreach as well.
Wonderful. I mean, the request, sorry. Hey, that looks like it will be a pretty good agenda. I hope everybody can make it to the December 7th meeting. We try to make it early enough in the month that hopefully we'll make quorum. So please attend if at all possible. And if there's other things that come up, please feel free to email Carrie and or Kristen in the meantime. So we will go ahead and transition to item number 15, which is public comment. I will make sure to read the notice this time. See, I learned. I didn't have that before. So to provide public comment telephonically, dial 1-775-321-6111. When prompted to provide the meeting ID, enter 54016324 pound. If providing public comment during the Teams meeting, unmute your microphone prior to speaking. Persons making comment will be asked to begin by stating their name for the record and to spell their last name. Having said that, are there any public comment? Not seeing any. We'll go ahead and close out item number 15 and move to adjournment, item number 16. Hope everybody has a wonderful November for our veterans. Thank you for your service and happy Veterans Day. You are well appreciated and honored. So, and then for those that celebrate Thanksgiving and Family Day, happy holidays. So thank you guys very much. Appreciate everybody being here and taking the time to support our kids and families in Nevada. So,
Thanks, Ellen. Have a great day.
Thank you, Ellen.
Thank you. Bye.
Bye.
All good, Carrie?
I think so, yeah.
Okay. Another one bites the dust.
That's right. See you later.
Bye.